Welcome to today's lesson on common defects of the eye, where we will dive into understanding myopia, short-sightedness, hyperopia, long-sightedness, cataracts, and color blindness. Additionally, we will explore the medical treatments available to correct these vision defects. In today's lesson, we will first understand what myopia and hyperopia are, including their causes and how they affect vision. Next, we will discuss cataracts and what leads to their development. Lastly, we will cover color blindness, focusing on why it occurs and how it impacts individuals. By the end of the lesson, you will also be knowledgeable about the various medical treatments used to address these eye conditions. So far, you have learned how the eye focuses light to form clear images. This understanding is fundamental as it allows us to appreciate how different defects affect this process. For instance, knowing how the eye focuses light helps us understand why someone with myopia can't see distant objects clearly, or why someone with hyperopia struggles with near vision. By building on this foundation, we can advance our biological understanding of how these eye defects occur and how they can be corrected. This knowledge is essential not only for understanding how our visual system works, but also for appreciating the medical innovations that enable people to maintain or restore their vision. Myopia and hyperopia affect many people, and understanding them is crucial for both recognizing the symptoms and knowing the available treatments. People with myopia have difficulty seeing distant objects clearly. This occurs because the eye's lens refracts light too much, or the eyeball is too long. As a result, light rays from distant objects are focused in front of the retina instead of directly on it, making distant objects appear blurry. Symptoms include blurred vision when looking at distant objects, squinting, eye strain, and headaches. Here are a few examples of treatment. Glasses with concave lenses that curve inwards spread out light rays before they reach the eye. This helps the lens focus light correctly onto the retina. Contact lenses perform the same function as glasses, but are less visible and more convenient for activities. Laser eye surgery corrects the shape of the cornea to reduce its refractive power. Replacement lenses involve adding a permanent lens to correct vision. In contrast, hyperopia makes it difficult to focus on nearby objects. This condition arises when the lens doesn't refract light enough, or the eyeball is too short. Hence, light from nearby objects is focused behind the retina, causing nearby objects to appear blurry. Symptoms include blurred vision for close objects, eye strain, fatigue, and headaches when reading or doing close work. Treatment includes glasses with convex lenses that curve outwards. These bring light rays closer together before they reach the eye, allowing for correct refraction. Alternatively, soft or hard contact lenses that perform the same function as glasses, but are less visible and more convenient for activities. Laser eye surgery changes the curve of the cornea to increase its refractive power. Replacement lenses or permanent lenses are implanted to adjust the eye's focusing ability. Cataracts are characterized by the clouding of the lens, which affects vision clarity. Cataracts can develop from birth or over time due to aging or injury. Symptoms include blurred vision, difficulty with bright lights, seeing halos around lights, and frequent changes in prescription glasses or contact lenses. The most common treatment involves removing the cloudy lens and replacing it with an artificial one to restore clear vision. Color blindness is the inability to distinguish between certain colors, most commonly red and green. This condition is usually genetic and affects the cones in the retina that are responsible for color vision. Symptoms include difficulty distinguishing between colors, confusion of colors in low lighting, and trouble with tasks that require color recognition. In terms of treatment, whilst there is no cure, specialized glasses and contact lenses can help enhance color perception. Those with color blindness may also use adaptive techniques. For example, learning to identify colors through context and brightness, using technology and apps to assist in distinguishing colors. Let's go into more detail about modern treatments. Contact lenses are available in hard and soft varieties and provide a more aesthetic and practical alternative to glasses, particularly for physical activities. Hard lenses are made of rigid material. These are durable and long-lasting. Soft lenses are more comfortable, but require regular replacement and pose a higher risk of infection. Laser eye surgery uses a laser to reshape the cornea. suitable for both myopia and hyperopia. However, it carries risks such as infection and potential worsening of vision. Replacement lenses can either be implanted alongside the existing lens or replace it entirely. This option is often considered for individuals with severe vision problems or cataracts. Let's work through this question to consolidate our knowledge on the common defects of the eye. Look at the provided diagram and identify which condition, myopia or hyperopia, it represents. Explain your reasoning. Pause here to have a go. Now, let's go through the answer. Firstly, note where the light focuses in the eye. In the diagram, if the light focuses before it reaches the retina, it indicates a condition. Light focusing before the retina suggests that the eye is too long or the lens is too strong, resulting in myopia, short-sightedness. The given diagram shows myopia as the light rays converge before reaching the retina. In today's lesson, we covered 4 common eye defects: myopia, hyperopia, cataracts, and color blindness. Myopia, or short-sightedness, occurs when light focuses in front of the retina, making distant objects blurry, and is corrected with concave lenses or surgery. Hyperopia, or long-sightedness, happens when light focuses behind the retina, blurring nearby objects, and is treated with convex lenses or laser surgery. We also discussed cataracts, where the eye's lens clouds with age, causing blurred vision, and is treated by replacing the cloudy lens with an artificial one. We looked at color blindness, a genetic condition affecting color perception, with no cure but manageable with special lenses and technological assistance. Finally, we looked at modern treatments in more detail.